That's right.
Okay. Me da masi bebre. Se Kristo mu de ye nyina ye nipa baakofo. Enti agidifo a ehia me da masi for the opportunity na wo de ama me say ye ma bebuebue ye health mu na ye nwene ho. Me nim se de mo ye no se bia edru question na ye kasa wie na ye the question na to aso ana se in between no obi pese bia ni re be fin to pese o interject ana so obi pajanensa. I don't know how you want it to be, but me open to all of it. Maybe be a make a sadia manusi na so be bisa question o mama nusi me answer and answer mo pese yenwia nti mesrɛ mo sɛ de mo pese yenye no mpacho mo
me pacho usually na speakers no pese mo kasa na mo church na yeah questions and answers and so but then it's all up to you and how you want it to go. You are the captain here.
Well, I always wait to me I can see me through, but said I can. I'm just so open to anything. Said flexibility. I'm so flexible. Into me kasana if you say be a really few question. Now open say we interject here is fine as well. And just make us say we are said the mon norm et no will follow it as well. Either must be brave. Along the line is soon patch me share slides. And you know say open say or take a snapshot and I say said the be ya so one our question be also obey to me afa every honum and ti me share slide. She said once I me share slides in a beer me kwa take corner kakra because of the how is the setup it no. And ti say be a mini so me also but the slide would take majority of the page at that time. So I'm said me tree bebre. So I say ye nyina be before I can for unless say more percent means someone no kakra and also meeting me I said make me very flexible.
Me patrocin na you okay.
Yeah, me that's
and then again me they can also be person or texting a message in so I'll be to me there to chat in sister we and so and so meet me I can.
Me that's very Philippa for taking that tax as well. Me that's it. Mpamucho ene ye bekasa afa ye pomude ho ya ye beka afa diabetes. Me narrow it down to type 2. Meaning say you will a lot of different kinds of diabetes. Now me narrow it down to type 2 because here be before me no. So we ma type 2 and a doso so few people you get type 1 be a obenya obi to say be a onyem ye and free ho be also be a na ne pancreas no and de ba ye and not so for but say na minim say more time no mo be ni mo de ni nyina becha ye ne enti na me narrow because bra Mr. Odum catch him say about 30 minutes na because enka me ko ni nyina mu dia it will take more than that enti na narrow it down enti mo fanche me say next time mo pe say yen start ni nyina open up so ye betimi amada opportunity no another time we da must say say you can say diabetes na wo ye kro mu kasa ma pempebre no obi bebie na no be kasa oh na sichire wo ni mu na abroso said ye can say hypertension say moja broso no bebre no obeka se bia oh na sichire wo ni honam no ebdoso said ye ese eye na say ye kasa wo sichire doso na echire sen edien na edeba enti ye wo organ bi wo ye nipadue no sa organ no pacho me be start a share me screen organ ye friend pancreas twi mu no ye timi friend no tan anase imemfa entoto akokɔ de ho ya ye frifie ba ye na se durubro nya na ye dwa akokɔ no unse ye dwa akokɔ a ye frɛ organ bi se tan anase gizzard anase akokɔta enti sa pancreas no ene ye mu a ye beka ne ho asɛm na organ na it produce a lot of hormones na de eboa ye ewo ye condition a ye beka diabetes so no sa organ no kidney no tan no and our pancreas and as a gizzard no the produce no insulin. You concentrate only on insulin today. Now the insulin ni say me no ye nam hui ye ka say me pija me nsa madwene ye adwuma me blinke me eye and as me bo mani makoma ebo me kidney ye adwuma ni nyina no pancreas no produces that insulin na insulin no ekwa na a produce glucose na afi e de akwa adwuma amaye. And to say insulin is producer mra body no adwuma nyina no. That is when there is yedidi no yedidi a yedwane bi wo hono ma yenya bibi to say glucose free mo. Me pese me use term no sugar sa na ye frɛ no but ye can say glucose. Adwane bi a yedi a yenya end product no turn into glucose. Ye ba yedie ma ye wo ye mo ye bayre ye wo manken ye wo banku ye wo tiozafe ye wo pano ye wo donuts ye wo adwane bi a ye flour adwane bi a ye tuber ye di wia na say ye can fruit so all the fruit say ye di apple ye di banana ye di grapes ye di bi adwane bi a ye fruit bi a ye di bi no so no and also there is sweet sugar in it. You buy your drinks, all the fuzzy drinks. You buy your frame, your chrome, your wasana, your all drinks that you produce, no, your chromes, no, nina so sugar womb. And to say sugar, no, whenever it's produced, na afe insulin, no, brain, no, aquacatre, brain, aquacatre, pancreas, and say there's a lot of sugar, a lot of glucose in your system. Enti corner produce insulin. Enti insulin na dia oye ne se okọ baby a glucose ne wo na akwa pick all the glucose in the bloodstream na e dia akoma no e dia akoma kidney e dia akoma all the vital organs na e wo yemu no no e dia ma no dia akoye adwuma because me no ye to aye kasa ye adwuma nyina no ye hia energy na ye hia no e through adwane na ye di ye no a glucose ne e wom no e na ye enti insulin ne dia ne say e ko na akwa sisa all the glucose in the bloodstream and then it na e dia akoma sa honam dia akwa no ama na ayusu. Yemfa ne say minidi ye no me kidney ye adwuma makoma ebo enti mede enya glucose ama no enti there will still be a glucose production by the brain said the erade aye no enti say me produce glucose naturally from me kidneys eba mu ebe produce hemfa ne beko ebeden and a body na make use of it enti insulin is produced 24/7 in our body. 10 bia there's insulin production. Na dwuma ya ne say ono de okwa akosisa glucose and the form no maybe ubeka ze esichire words nipadua no okosisa every bloodstream no e de akobody no ama body na ba be isu. Me kan bloodstream ana me pese me kire say yemfa ye fie pipe enye mfanto ho. Se ye bie yesuo ye fie nsuo na de do ben na nsuo ni fam no e na make us a bloodstream no enti glucose ye didi wia yenya ye carbohydrates ye di ye fufu ye di ye mo ye di wache ye di pano ye di bo fruits ye yawe chips chicken and chips ye di awie no ye di lasagna whatever food that ye di awie no sugar no akwa pipeline no ana tube no eti honom. The only place a betimi akọ body no is when there is insulin production. Into insulin edwuma ne say ya didi awie no ebekọ akọfa sa glucose no eti droben pipe no blood vessels no e de akọ wherever it's needed. Enti baby one produce insulin no honom no na chese gina bloodstream no na obetesi a yebeka akiro say o sugar akosoro because the sugar, free say sugar no, say a free drobenum and our tubes num, echo into the tissues, echo into the organs, echo into the muscles. Hona here. And to the moment anchor na ebejina bloodstream no, honum no, and na otesia ubehu se u glucose ekosro. And timika type 1 and type 2. Type 2 no, type 1 is nipa no or pancreas no, but ontimi produce. And then a type 2, boom. Type 2 no, me know you type 2 no, you produce insulin, all right. Insulin is being produced by the pancreas, but then enam say other factors intino entimi enkofa free bloodstream no droben and tubes no emfa ne nko heart no emfa ne nko kidney emfa ne nko brain na afeni aka no so install in the body as fat as yet no na DNA see the AC ni say most of the time no aya a produce but intimi nko ye free bibi resistance say ye mu dru ewo ye furu mu say yem no esu kakra na fane say ene man yemfa man ye enfanto ye say ye free bibi corset aye she so ubo corset na too tight. How do you feel? You feel uncomfortable. And to sana say yem ni ye kese there's a lot of fats, not fats, cover pancreas and other organs. No? So it becomes so difficult for the insulin now, pancreas now produce to be able to work effectively. Yemfani say obi wo ho a onyemye. Anyinse no hormonal changes are happening, especially mana semna maker. Enti enoso manipa no etiminya type 2. Ye didi wie so a ede na ye. Most of the time, say ye bema ye insulin aye active. What we need to do is say ye didia ye bema ye be ye exercise kakra. Enti ansana ye be diagnose obi se owo diabetes no. Ye blood test. Blood test no bia ye be kase koye wo lab. And I say GP ye be kase oba surgery ye be kase ye be preke onsa. So we check your blood sugar. Na so we fear blood glucose. We fear. So we need yes, but to say a year 4 or at times 3 to 7. We need and on your friend fasting blood glucose under 3 to 7. Na say where did you swear? Yeah, expect to say a beko above 11.1. So where did you? One of no may be a checking about there may be a lot of factors in one of no a course. It could be say be a aduania would is so not digested and there's a lot of glucose. You say we are within 4 to 5 hours no now come the until that time no na aduane no akọ baby a circle glucose na akọ baby a circle and be a udidi na ani test ye ebi so ana on sakra yemfan say where the aduane bi a sugar wo nti aye wonsa enti the best and accurate one yebeka say bi a repeat bio ana say yebeka say yekoye lab test and no ebe effective ama yehu enti one of no it's not a panic but rather it's a caution and we let you to do more to find exactly what is happening. Now pamchona may narrow down to type 2 diabetes no. Na yehu de kan yehu say your pancreas na tan no ana say akoko mu gizzard no no any produce insulin. Na insulin na dwuma ya ne say ye didi awia na ye nidi na am say body no all the time you hear glucose the source of energy obey you suniti no there is insulin production insulin producer na kwakotisa glucose no na de akoma no e de akoma all the vital organs no na say didi still as biaka na store under the skin as fat. Na you can say no the akoya can say diabetes akoya big issue now. I will we are seeing enye abibifoɔ nko mu enye UK ha nko a na the urban says say no a lot of people are coming up with diabetes. A lot of people are coming up with diabetes. Na yɛmfa ne sɛ sɛ uyi say the nansen bi ɔmo yɛ research 2018 ɔmo hu sɛ nipa enya type 2 diabetes no nkɔlaa first no nanka your friend is say adult type of diabetes when you're 40 years and above and na utiminya and then no, at the age of 18 25 30 and under 40 people under 40 years of people no a lot of them are getting type 2 diabetes first near say over 45 na saa nipa enyen se uyi nipa 6 yemfa nse se wako ward na se nipa 6 eda cubicle a saa warded area na saa nipa 6 e wo ho no at least mu baako ebe ewo type 2 diabetes uyi nipa 6 bia at least nipa mu baako ewo type 2 diabetes which is so alarming now because one said them kind emudro said ye kesifa weight gain ewo aye idea I say abeye common ewo ye environment no enti eno so ye the main cause because me referring say ye mu ye dru na say pressure no fat deposit no press all the organs now it makes it difficult to perform its function, especially the pancreas and it produce insulin no and I'm say body na ye kesi no yemfa ne say o pipeline no odro ben e wofie no hwe time say musia what happens obehu say nsuo no entimi nko enti saa ne emu yedura though ye what type 2 no pancreas no produce insulin there it's very difficult to cover all the body surfaces because of kese na ya ye ninti no it's say government no drive ne say and I'm said that type 2 diabetes are common no and if I means be obesity be na you be reduce the source and how it's happening no albino egusua all year enti na ye kosu bi wa na ye ka say nipa nsia bi e wo ward bi no omu baako ebenya diabetes emu baako e wo diabetes and ye ka so say people under 40 years no akwakoye adia aye common na other factors causes yetiminya type 2 diabetes maka say weight no baby aye free so yaka say abibifo unfortunately ye bibifo musu no and also aye common wo ho omu claim say health deprivation because I say your health ain't here ye bebre ye didie ain't here ye bebre young pet doctor hoko bebre ye say ye be discuss your health issues and the West in the company say about a researcher that's where I'm coming in here there be a mokaso akesifo before so entina the type 2 diabetes, but they want to find out say adenti na before enya ebasi ye researcher ye before obia don't want to go in because ye mpese ye be you see as scapegoats enti omu edi egu ye so say before for some of the time no reason but enam say before nipa mienu or ya check it na the blood sugar was soro when you diabetes number 2 aba or also ya test it when you diabetes number 3 aba but they don't do any scientific basis because we don't go in for those research enti omaka to yes so say before and I'm say yes so and I'm say yeah genetic factors and I'm baby are free no that type 2 diabetes common away. And to be frank, Osha me case loader. Before a woman biano, type 2 diabetes. And now before a woman also type 1 diabetes. Now, interestingly, obi free a chrome about recently. Now we're treating who fear with diabetes type 2 na or inye ye. And to obey no near so there be quiet test for fraud. And fascinatingly, this lady is being diagnosed as type 1. And she's the first Ghanaian who's over type 1 diabetes on my caseload. I mean, that aspect, yes. And omo abu so say a before yes so ye did ye pay yes ye health mushe baby are ye free. And another course or more science can say genetically yɛmfa say me mommy will be, me papa will be, me wofa bi nyaa bi, me mommy nua bi nyaa bi. And there's the possibility. And really this lady who taking a history, there is that lineage of diabetes running through both maternal and paternal side. And these things omu based on it say taking the history of the person and so ma who say bia and also your cause in tia assume sibinya that type 2 diabetes, but rather they don't go further to find out say diabetes na wenyano 1 or 2, but there are different tests they test Enti na yehu courses na yesi yemudru de ye di ye yempe ye health ho asemonka ye maame ne ye papa ye busuafo ewo bi ebi a yenyem ye ene yenya bi eye ma no nti ye san nyem bi wa the possibility say ye benya bi no eye high ana say ya nyem bi okra na enam say ye bu ye dru no eno so ye factor in the past na ne so say u free 40 years to 50 years na or risk factor high. But now who say even young ones are getting it. And that age it's no more an issue, but rather saying that you me educating on their health. Not just a causes what diabetes. Now say obinya diabetes said o ye call na say when your malaria ye test na ye hu say malaria parasite wom ana say bia o ho ye hye when your fever udidi enye ni nasefo. There are also signs and symptoms war diabetes mo. Say obi benya diabetes ana say when diabetes na onima ubon se nipa no say ahyiwo mu say ahyiw ni mu obenum nso bebre eni nsuo no obenum anum onum ne bonto ne yam obenum in gallons but still obenum bia na nsukom saden obenum bia na nsukom de no obenum bia na nsukom de no enti wonum nsuo ni bebre na the other way is say no matter how much you drink say okodwunso enti wonum no so no na odwunso fam onum no na odwunso fam onum tinsuo bia obenum bia no na odwunso fam mipam cho yemfa yenko science mu kakra bi yehwe eba bia asichire wo said ye de asichire enu egu nsuo mu enti na am say a sugar no I concentrated ewo blood nti no epese ekọ free blood no enti nature's own way no ebema wanum nsuo just to dilute the sugar. Enti wonum nsuo se wo dilute sugar no from the bloodstream no na afi odwunso enti ubehu first no yesusa no yesu wo kan odwunso hwe a ubehu se asichire wo. And really, because the sugar is so concentrated in the blood, ubehu say there is also sugar in your urine. Enti ubenum nsuo sa onum nsuo no na afi odwunso onum na odwunso me can bibi say your body no here energy. Aduane a yedi no yemfa nse wafa sikakra still enam se utimu se wo energy because naturally body no release glucose be a store wo body no ediama but this time no udidi enam se glucose no esiti ana eti ewo bloodstream nti no entimi enko muscles and the body no ema wunyusu nti obehu se no wa heja wa yemre udidi so wa emre edru baby kra na obehu se aduane kra enye wakono bio untimi nidi obehu wo obi wo so obehu na o lose weight onye na dwen se o ye exercise onye na dwen se o diet amane so ate nso obehu no na obi wo hono ma na o lose weight lose weight no because uni aduane na wadi no entimi nkọ body num normally yedidi wie yedi efufu na aduane yebedi bia yedi wie a na se body no enya de ohwehwe wie a ne aka no wakọ store for future use. But yet there's a situation and I'm say insulin anywhere but take glucose no into the body now store ni aka no ubehu obi wo no was start to lose weight. Because say ojo so a ubehu obeti se sugar wom a man memo se baby sugar wo bebre no ma hono infection eye common into ubehu obi wo no ma na yase ananase so ye oba obemo obetimi enya thrush obehu se na sekeka no GP be treating ne obe treating china obehu na eko frequent trash ewo wase eba obemo eno so common ewo hono se kro bi ato wonsa wonan a ubehu se sa kro ni enwuda because glucose no blood vessels na wo ye nan no so tiny glucose na kwa akwohyehyem asisa kwan no entimi ma blood in flow yenim se baby a blood ko bia no the oxygen ko the nutrients ne ko nti sa nutrient and oxygen no na nka beko akwa kro no awu na enam se entimi emfruit no ananse circulation poor nti no ubehu kro da wo ho a enwu ube treat ya enwu ebetimi ase bi kra na enye wo nan na eye wo nsa ana kro beto ho baabi ubeye ne den a enwu da ebeche ansa na because circulation poor bia wo nhye glasses nso ubehu na wani so aye obisibisi o kan ade a na abo afas obeka say oh ase nsuo gina mani so ne nasefo. Unfortunately there happen is say glucose no say ewo bloodstream no amu a yentini no bi wo ho a nkete eni ahoɔden na ensososo enti glucose kakra bi a bɛkɔ akɔtare ho no na afi entimi enye na adwuma sɛ ne etie ebi ti sɛ yeni achi ntintini na ɛwɔ yeni achi no blood vessels na ɛwɔ yeni achi no so tiny sɛ glucose no ye too much a ubehu na akɔtare sa blood vessels no etare ho ana affect yeni no so no ye ka bibi so sɛ erectile dysfunction ne nasefo ye mpamoche mpanyifo say ye nyina ye mpanyifo ne wo ha no emema ye penis blood vessels na ewom no so tiny enti ubehu glucose no so much baby blood vessels will be concentrated so it needs to be taken away from baby blood vessels no eco tissues no but I'm say insulin any honey no na vessels no esisi enti ubehu no bema enti atinka saa na oba so no in the vagina so and also your sign war small blood vessels glucose no ekotare ho a eno so no obehu na oba so watinka ekofom as well. Nti na afe sign aba nti there are a lot of other symptoms peculiar to other people obehu so obeka se nipa de beka se oh me anajo mintimi na because my restless every second be na say me sorry kojun so every second be na say me sorry kojun so enti no na eno so egno no ye ba beka eniema say diabetes no eche wo ho a de sign ediba say mabobo bi so kakra say wani unhuna de ye emea ana mema yennamusu no erectile dysfunction and lack of sexual drive. Mpacho other organs so diabetes se sugar ni dọọso ewo blood vessels no nasa entimi nya adwuma yi a entimi nko baby ese kwa certain vital organs be etise kidneys your kidney no so said them kind eno so wo tiny blood vessels enti sa glucose no are so much concentrated no na kwa kotitare sa vessels no, and it makes it ineffective. Ontimi nye na adwuma eye a yenim se kidney ne filter aduane a yedi nra ye nom nsu a ye nom ne nasefo enti behu na kidney no so adwuma no ekofom na ekofom atil ebe shut it down ne afra no bibi ti se kidney failure. Me kan kuro ho asem se kuro no behu kuro ne itimi nguada obe treat yebe ya enwuada enti emra enwusu no circulation no egusu eye po no ubehu na afe didi kuro na didi akone nan no ma na ese yetwa enan no ana se baby kuro na kuro no enwuda no minimum bi a yetwa ne nse bi afri honom just because of diabetes ana yetwa na basani bi afri ho because kuro ne ba ya entimi enwuda. Na ye can heart attack, stroke, and your workers are then a diabetes, so ye can stroke one sem. If I told Yakuma no a heart in the sono, or those who were these tiny, very small and tiny vessels. And tisa vessels, organs, beer, what tiny vessels biano, glucose no qua attach or honum, or attach here, I say, or pipeline no esino entimi enye na adwuma bio because glucose no amane aye ineffective enti no obehu na akoma na ese enya moja bebre edebo no glucose no atena honom afie no entimi mo entimi circulate ye ne yeso ye nyina nim se stroke no whereby there is lack of oxygen moja na aircon no the oxygen enam enti saa ade enya saa effect na obehu na stroke bam ekoye brain num there's lack of oxygen there ananse bia vein ketwa na blood vessel ketwa na ewo yetiri mu no enam se glucose no attaching so much say intimi stretch intimi nye out no it try say ye na adwuma na obehu there's a tear na afisa tear no ama moja ejina baby faako ewo tire no eno so eye form of stroke as well. Me can say nerves no so ewo blood vessels attached to them. Nerves no enema yinya ya tinka sensation in asifon. Enti and also blood vessels are a supply no oxygen any nutrient no. Enti sa nerves ni especially the way 9 years no. And I'm say a way from the main body no. The supply no have to be robust. To say the all pumping so no. Obi a ote abronsan so a se Ghana pan ade example up te abronsan so be 3rd 4th floor ye pumping so a de oben no more advantage because onyan so any more say wa owo soro no enti ya body no extremities no pressure no too slow and sluggish na face no ya glucose asen akwa akotitare mu ama afie de kra de enya kwan kra na flow ye enti sa nerves no so no obehu obi wo hono ma o say which is very common. Oh, me sorry, be an amina normally 83, but we step on say a boost blood flow back. But yena, unfortunately, glucose na attach no. Oh, sorry, na se oh na suprana. There is no boost, a bema flow no akoye because it's sluggish and it's covered and clouded with the glucose no. And to most of the time also I say you can't say anansi achime menya numbness and nipan onante kra no tie bibi so a sensation no low on timpo say bibia won ana bibi atwa no na afi a lead into kuro say kuro no so no wo san treat a enkoda ubehu no most of the time no ye num so no se wo bie wanum na wo hwe inside o cheeks anase o katre masuru ho na anase a utim hu se line kitin bi those blood vessels no and also eclode with the glucose na afi eni ahoɔden ni nti no bibi kakra bi no na ate bibi kakra bi na ate nti wobɛhu obi wɔ hɔ nom a otwitwiri ne se a occasionally bi a otwitwiri se a mogya betimi abadeɛ but frequently and time bia wobɛtwitwiri se bia no na de mogya ne nam a it's worth also checking your blood glucose levels as well. Make sexual problems, sa erectile function no, any lack of sexual drives, ni nyina nerves na ɛwɔ hɔ no, anya glucose no attaching so much that it become ineffective, it become insensitive, and you know, so bema na ni bema and sorry, ɔbaa so a yɛbɛtumi aka sɛ bia na hormonal changes man yɛduru time bia hormonal changes so affect menopause ne n'asefoɔ but with this no wobɛhu sɛ mpamu agorɔ no anigye bia anim ni atenka bia ebi wɔ hɔ koraa bɛhu na ɛyɛ ne ya ne n'asefoɔ enti ɛno so no some of the late complications na sɛ wonya diabetes a meka sɛ either say yɛbɛyɛ blood test lab ama yɛhu anaa sɛ yɛbɛka sɛ yɛbɛpriki wo finger bi a yɛbɛyɛ more than once ansa na yɛakɔmfirme sɛ wokɔyɛ lab blood test na yɛfrɛ biribi HbA1c that is hemoglobin A1c obi a onya diabetes no o deɛ from 39 to maybe 40 or 42 and then nyame NHS and our health say almost share almost 5 year data NCA enti uye obi a over NHS app ni bia your blood test and I say anytime uni GP benya encounter biano you can see information unu GP call yen ewo phone so we are mede and na say if you want to follow up so and also another way obe health and your data with all the services are all attended. And to say who say be o blood glucose no abro there be a bro 7 we need ye cry 8 a 9 and HbA1c no abro 42 na between 42 to 47 no yes so you're pre-diabetic and you best started with education and other things and anything about 48 naturally say full-blown diabetes I say you treat it. And say basa ye treat there are ways yebeka say you be treat you with diabetes. You bet me at what started most of the time no you started with education or be a the way you exercise way ye bibi way na OGP afro after 3 months say be a do catch utimi ye na ukoye na say improvement about fine improvement madia na just say you do to a so you bet me amount tablets you bet me edit tablets you bet me ba mienu miensa akeka bom anase you bet me aka say any yen start with a panel na the mahu ni say ye ka say ye start insulin panel na aya de ye kan say oh any na me diabetes no akwa chire yi and bi wo ho so a pancreas no said the kind insulin wa ye adwuma na chese kesia no ne fat na ye no o mana ye adwuma na wabre there be a try so be produce chese wa she corset for 24 hours. How do you feel for 6 days, for 7 days? Won't stop here. Corset in show all the time. How do you feel? Inti pancreas nebe ya na fe no wabre. Inti so breast ade dia and the tablets bia o de beba no enti mi nye ye. Inti just say ye mouth artificial insulin because you need that insulin to take the glucose from the bloodstream. Early stage you bet me say okay pancreas na ye adwuma na emom koye exercise kakra ka ho num aduro ba ko bi ka ho na ye nhwe ebe kakra no ba ebe hwe no bia na akofom dia aka se toa so na ankofom so a ni aka se okay na say de say ye sign ede enro ni ebika ho anti-nro no based on baby or blood glucose no one and be dependent a drew and na in ra say yedema at that time. na the most important thing I think your person you who your bed then a boy who by a free sa type 2 diabetes. You can say type 2 diabetes no. Yes, say, and I'm say pancreas ni produce insulin on the o produce or ye nejuma all right, but and I'm say kesi wo ho no ya tight a fat deposit intino and insensitivity of the insulin intino intimi nye nejuma se ne say enti die di kan say ye be lose weight. Yemfa ne say wo die no kra de obi wo ho ana onso wohwe na how come me kai say lady be by me hwe she's half my size but na ne glucose level e was soro enti upon commodity mu bebre no onye obi a oye active odidi wie ya na wada enti odidi wie na wada insulin ni produce there but it's insensitive enti mi enye ehia bibi ebe kenya no amana ye na dwuma yie. And no, all she needed was to do a little bit of work, a little bit of exercise. Na odi akaho na fe we free that state no. Enti the kase exercise ebi ana mpanyinfo wom arthritis wom na me de meden akwa akogina treadmill so meden escape meden aye akoye Hussein Bolt etu America say sorry na say bia yete abansoro ana yefie ye wo stairs wo so a say ye sane ye ba ye sane ni ye ban exercise say ye wo bi o ye wo garden and say ye be before the yempe garden bebre say bia nka ye wo garden na nka ye yemu adwuma and this time anka planting season and harvesting your garden mu afu no inse say ye befa obi abana do no na kakra bia wo de say wo be se bia na wotwe bia mekwa akodo fa kakra e wo me garden that is obi oye garden woni garden na say ofie stairs wo ho no ma try and use the stairs nyese bia me ye brebre na mbesi forma no pa me kosuru biwa ya ye bia ye de ye wo urine na wo form ne de ye kosuru biwa na je say ye kwa akoda ye si form ye be ye aduane wie ni atena ye TV nanim and so the aba ne say some of the TV cry you can even use voice to talk to them so utna TV no you don't need to do anything. So be sorry akohu bi no there be remote and only use and now we use voice to control our TV until we don't move at all. Until bibi kakra bi a ubetimi aye ebema wo move o muscles. Bibi kakra bi se bi a yemfrey ba kwadwo sorry for nsuo breme but rather kakra be sorry akọ fridge no ourselves akọ yemfa no se wadwuma yo obi a oye police ni oye nurse ni oye obi a wadwuma ne ema wonante oye ka ticket attendant intino onante bebre oye teacher ni classroom okoba no ye o normal duty a oye so that is not exercise ye wadwuma we ye ne da bia so say oye nurse ni na woko ward na wo nante up and down oye car park attendant ukoma ticket ukoba yes o normal worker oye ne da bia enti sa nipa sen obefa bi different as exercise away from a normal routine because the body is used to that say a normal routine into any exercise for the body. Say ye pasa na me say na ye born ye start ye near born yum kama enti so fie na ye be start program na asa ye starting yum na fi wo de sa just move muscles sa na ye ne ye ma ye nananom say porch kakra bi wo ye fie garden kakra bi wo hono ma ye to ball o say wo de wontimi sorry kra o to ball na wo use wonsa you using a bit of energy na oni o ma no activity and to exercise any form of normal routine exercise ebia boa de ye kan bi so aduane a ye di ye bibifo no ye aduane bebre no containing a lot of carbohydrates no rarely na say yɛmfa nse say deɛ kra deɛ yɛ adeɛ di bebree na yɛdi fruits kakra yɛdi ɛyi kakra nanso wobɛhwɛ yɛ fufuo no na fufuo no na nkwan kakra nam kakra na fufuo no kakra anaasɛ rice no waakye no bo fruit no nyɛ bia ne sɛ yɛakɔ gathering bi na ɛsɛ yɛdidi drinks ɛtoa so drinks no yɛdeɛ yɛ malt and that kind of thing anaasɛ yɛayɛ local drinks bi ne yɛde aba hɔnom enti anaa cookie na yɛgu so na yɛnom enti sɛ yɛbɛhwɛ yɛdidie a ɛdidie mu no ɛnkyɛ bia mɛhyɛ a plate of sɛdeɛ yɛdidie mu ɛteɛ ɛdidie no nko could be another topic of its own sɛdeɛ yɛbɛdidi afa enti yɛdidie mu I know say we are trying and I know say bebree wɔ hɔnom a they even know more on this than I do but majority no yɛbɛhwɛ no na yɛdidie mu ɛna ɛma yɛkɛseɛ no yɛ source of aduane a ɛdi no yɛdi no ɛna ma your glucose level ɛdɔɔso nti ɛdɔɔso so deɛ nyame adom ɛdɔɔso na pancreas ni produce insulin na ɔno deɛ pancreas ni bɛkɔ akɔyɛ n'adwuma ɔde ma heart ni brain ni na all the organs ɔmo hia deɛ ɔmo ka wie a glucose no aka wɔ insulin nsɛm oni baabia de kɔ gye sɛ ɔde positi ɛwɔ body no under the skin na akɔyɛ fat ama yɛ nti sɛ yɛhwɛ yɛdidie mu ne yɛdidi yɛ plate size no yɛdidi kakra fruit more menim aborɔfo no yɛkɔ breaker obi bɛba na ɔde salad bɛba obi bɛba na wayɛ soup na mehwɛ m sɛ oh na soup nko a anyway medeɛ nyɛ saa na medeɛ teɛ nti wobɛhu no na yɛdidie no ɛyɛ different nansɛn yɛka prevention na government who say type 2 diabetes a problem to say nti yɛse NHS prevention program so wokɔ NHS website put in NHS prevention NHSDP a ɛbɛma information kakra ɛno no wodu weight ɛne wo height ɛhyɛ ɛbɛma risk factors no ɛma risk factors na utimi hu baby a wegyina anaasɛ wode kora book appointment with your practice nurse say bia mepɛ sɛ ɔchecking me ma mehwɛ sɛ mewɔ risk factors no ma now what the surgeries a GPs for ne yɛ ne sɛ ɔmo frɛ especially yɛ bibifoɔ no paa I don't know mo area there but my advice is say o practice nurse and our GP mfrɛ just do it yourself kɔka sɛ ɔmo check risk factors no apart from say ɛbɛyɛ blood no or do weight and height ɛhyɛ sa program no ɛyɛ free say more offer only say time consuming obɛyɛ no once beginning no first 3 months no maybe be once every week so for the whole program 9 months depending on the area some goes as far as to 1 year but omobe spreading it out na omaka aduane exercise and all other things so now that is what is driving diabetes now we call it diabetes prevention program and to say your cost so program way there obia over risk factors no ebetimi aboa a delay time ubenya diabetes nibi yemfa ne say when you be at the early stage sukrana utimi ka kire u GP now practice nurse say on refer to the prevention program no ukobi no omukasa unfortunately before no omo refer be bra yenko ube send a letter udi bibia beko yenam say ye dwuma ne ye family life and intina brofo ne ka kire say we are health deprived because services no but we're not making very good of use of it. Yes, I be at some of the surgery no krano omfro and I say attitude and behavior and I say time e be fro no krano na enye good time for you enti ubehuni e be fre no onkokra and I say unya brain na wako enti say ye pese ye prevention no padia the best is to have this diabetes prevention program, to enroll on that program. Me pacho na ye bio na ye say 5 things be a boy. Me pacho me be changing me slide no na me the food plate no ene we no achiremo. Timpacho me yi slide we free on. Me pacho ya big enough. Okay. And he say ye didi yes, first and foremost, no, ye play size no, rafom. Ye use play size ketwa, and yet the normal plate. So obey you normal plates na, and now boa ye hipunema. Nemum yamanim rafom. Saki kesiana ye won ye way fear, ye make sure say, dear woman no enye kakra. Enti se wohwe ma yellow part hanom no. Se uche plate num 5 this portion hano. And I say, yeah, nka ye board, ye bunch, ye fufu, any ye mo, ye wache, ye donut, ye buff fruits, ni nyina size say, na say ye yano. A lot of greens. Minim say bebre MP greens no. And it say ubedidi anka say, and na say aduane ne ye. Na yenya ye protein fat ye protein ewo hanom ye chicken ye eggs ye fish and all that so they make no when we're talking about diet eno nko so ye topic on its own na afi ya bakakra ye dairy ye benya ye vitamins ni ye minerals so wom so na eno so aba enti ka ye didi anka ye be factor we nyina bi wom less of that more of that. But rather, did the opposite of that. Be cry, lucky, ni benya wake a crow. Lucky, of course, protein so dear, at least, ye protein no more. A do a hokrana, not protein, I am more than this. Protein no red no etim ye more than the green no nti sanka ye bema ye green part no aye kese ada kese chain ada what is on our plate and kebeboy but rather we tend to take more protein and less of the vegetables and the greens. I'm sure that may change ways so now made another slide if I can get that slide right. You can be say you pese ye exercise say exercise kakra bi a wo beye do say wontena si bebre kakra bi a wo beye no e be bring your blood glucose advantages or blood pressure HbA1c lipids and also your cholesterol which is also another thing altogether. Exercise kakra bi ye increase physical activity saa nneɛma wei nyinaa aba for my including our depression level. Yes, sorry, na yɛtutu step from yɛfa yɛ staircase so instead sɛ yɛkɔ adwuma yɛ train station instead sɛ yɛbɛ free escalator no so you free escalator no so ne yɛ walk through the steps these are some of the factors advantages yɛnyɛ free. Bibia ye be ya ebema ya na de kra de thank God whether ni no we bibi kakra bia obehu se na mfifre too enti se cold weather and anytime bia bibia be ya ye be sweat no. These are some of the advantages we get from it. Bibia ko form your blood glucose ko form your blood pressure ko form HbA1c ko form your fat lipid ko form you can cholesterol no you increase your physical activity depression so ko form. You can strengthen and say be exercise be a we throw BB said ye be muscles no be den enti saa nneɛma bia saa nneɛma we ni so bia no ye nya benefits wo ho. Adequate sleep I know you waste a friend of 5S6. So Satan, you break Satan, you increase your self-activity, you increase your sweat level, you increase your physical strength. Say menkase bia ukbe ti say azuma next and anase ukwe but bibia say wo throw ball say bia sorry kra na your muscles ni say bibi be best strength your muscles ni help na yebenya is very bad for us to get good and adequate sleep. Make us say ye 12-hour ye ba say ye hwe nkwala say ye school run into ye ba bia ya na 3 hours. And to say ye good sleep so and also mwaye. And a good sleep no so is a quality one. Say bia me da na madwene ninam me dwene said the Ghana for frame me say me this kind of call me dwene say bia say me project bia sikana kwhye baby enti me da hoso de na me sleep no enye quality because my brain and my mind is wondering about thinking about other stress issues surrounding us here before unfortunately abusuafo ofre say yekoye we wo fie ya nkasa ya brabo mu no ye to ho no ma ye na bia ye nya enne papa bia enfree mpacho na me on share sa screen way so enti say ye betimi avoid it, prevent diabetes na say ye boy ye ho modern enya physical activity ewo ya brabo any form bia ye betimi enya activity bia ebema ya sweat activity bia ye ntena si bebre activity bia ebema ya dwene ato form ama yetimi ada iye ye didie mu no so etisen ana ye didie mu and the main factor ebia beka so obi a menso mididi ye nenso what are other things bia untimi nye ne ye enti edi we eba and I said the American say what started and now winima diabetes prevention program no it's what is driving diabetes care now finally nimpachona make say utimi check so oko NHS oko Google now ubo in I don't know the phone you are using ubo NHS app ebema ama wa register into so register some of the GP no just be a OJ password but majority you don't need a password ubo na register GP details their blood test ni bibia ukwaye blood test ni bibia utiminya information na one kasa no watimi manage or health locally I'm say but take it and remember me say how long and then say we take it and to some rimpamcho me the beba awie for type 2 diabetes no and to me the massive brain I'll share my screen now my ready for any questions.
Wow, this is very impactful. So be ni bebre the nyamia se say ono ankasa nim de ope ene ne awoye na enyumre yanye eyint no nya time etumi esan call mu in depth pa ama etumi aye. We still have some time to go into no samre and sister Rosemont Yankopon show afe ensemisa time aso se ne okaye no asa na opese okasa brofo na abeka ye be share message na abeka sister ni mienu nyina wote ase opese typing so na wa type opese okasa ubi o mic na wakasa na opeja wonsa ye be hu na wakasa ntime pa cho ekwan no ebue. But as we wait, sis me pa cho me question back. And then na obeka kire obi a ono only diabetes. Na mom no most of the time the blood sugar to be called from like at any point in time won't say now call from now said the ya can nkete actually just open baby or sometimes just on crowd it says sugary food ne to say the diabetes ni be crap pepe but on also so our test am I catch when say only be so HB1C they are dealing in why but mostly sometimes maybe can nam 2.1 and 3 point something you know then now be catch any baby sounds.
And there's another side of diabetes, your friend endocrine. Enti saa nipa will advise say ompe ni GP and refer ni to endocrine. There are certain hormones, the insulin is a hormone, other hormones are nipa ne elake. Enti these people no you're from non-diabetic hypoglycemia. Enti nipa no mani GP and refer ni to endocrinologists. Enti hormonal be different tests like thyroid and all other. Maybe it could be that side and Tinipan experience that to definitely here endocrinologist to investigate that.
Okay, me that say. But you maybe some deal, monso some deal.
Me pacho eja pokuni mpese me bisa kwanda kwa.
Me pacho kasa.
Say diabetic problem no me type 2. Na no me koye blood screening diabetic eye screen, and they gave me a report which was so encouraging. Say maybe be one next year. Now physical part of training, and that's activities, most times, me now na me te ho. This is a spinal patient. Into me movement, very, very limited. So me te wa na me te akonya, me te akonya mu a na me da ho. You say my risk of moving, very dangerous. Over here, a lot of mechanisms are any carers, What of say most times, me take chair no more. It mean your pressure sore. Say nurses say maintenance just for 2 hours a day. Now me movement and as me exercise, and so much, what other option? And it me aboa me a me mobility very poor.
Pacho me da si bebreja. Me name se paralysis no one nine and now one sa. Maybe I
My mobility, my left part of the leg, I do drag it on the floor when I keep standing. Ebasa na eno nso no I said the ewo so bisa no. And my left hand no spine moves, which is C45 and also affect me left hand. Which is the fingers 5 Samiama poso and it is always closed. Which gives me chronic pain. So the doctors has told me, and they have sent me a letter to join the this team, the management team with me for the chronic pain, and if possible, the type of exercises I can do. And because of the spine, so they are not allowing me to go for gym because the type of exercise I'm requiring, they might not know exactly which one is okay for me as a spinal patient. So me no ka say me da ho. Gyina hɔ pipe na aka me sisi nyinaa na etutu me. Nti ama very, very immobile in one way or the other. So what is your advice for such like me?
Me fache me da si bebre. First and foremost, right hand, Juma. What's the left now? And to right now. Oda honoma, I don't know so whom ya upeja on that right no.
Right one. Right one there, and when I keep him up, but the small finger was also affected by the spine problems. I only have 4 fingers on my right.
Right.
Which I use it to drive my wheelchair and other activities, but the left one in there and the left leg, is almost immobile, but I can stretch the fingers and it comes back again. So I'm a ball,
Yes.
but it keeps on the same for
Mm.
almost 15 years.
And kami be suggest ball no aka ho. And some of them, I mean, say I appreciate the situation now no. So they work 15 years now. It get laborious, it get hard, it got difficult. And oh yeah, because so I mean who BBI and major, but say one koso and you ball no. Now, what exercise? Many physiotherapy said they work at definitely you will need physiotherapies to appreciate your C4, C5 issue. And now on me, I diagnose, I prescribe the perfect exercise for you. But my point of view, say you be increase a little bit of physical activity. No? Once the right side in no, you be use right side no, move around. Okay, I say 4 fingers. The fifth one ain't me near you, mano. And I say just you find difficult to stretch, Me patcho say what the ball is shame. Na upeja, na umia. What the ball is shame, na upeja, na umia. Of course, because it's nerve damage, it's so difficult to regenerate the nerves. Na the nerves no so answer anya adwuma so a ebesen adakujo tokra because baby a wonyu su bia no. Use ube compare on sa benkum ni nifa na ube hu say there is a bit of difference between benkum na enye adwuma to the right na ode ye adwuma kakra no enti say organ bia na say part bia da ho no say enye ineffective a day kra enti menye bibia a sign lose muscle tone enti say left no ube koso at the ball that shape enti ukuta wonsa forward ball ni hye benkum no na ode miamia peja na de peja na ode koba na ode koba na ode with the good one no na ode support the affected one no se eba se heavy movement you be move right side no yensa no oda hokra na move ne kakra na o left leg no so no oda ho na move ne kakra nti kakra metimi aka wo ho no na emom definitely chronic pain so etimi ema untimi nya hwe kra and is best say ubenya physiotherapist obe prescribe the right movement management and I'm glad to hear say no so or eye screening aye better. Into anything you aye good into or eye screen aye better, but enditory appreciate say most of the time. Na kai say deteriorate name better no. Is it due to be our diet na what is so and say BB you continue to do it. Said the beya eyes no deteriorate, but a better.
I mean, sure.
Wait,
Uncle
John, physiotherapist. Physiotherapist. Now, almost every 2 weeks. Now, almost extra me standing frames and the waist and reclinable chairs, so met price may move at the back. Also, they do advise me say I should be very careful not to fall. Almost so intimidate me. Likewise, the carers when they come in, no, we are not allowed to touch you. We need to call you an ambulance. The big takrebi mess unless the ambulance comes, no, they will never give me any answer. They will also damage their spine. So these are the challenges I have been moving, but the physios, they are coming at regular times. That's it.
Me that's part. Normally, I was what do I draw cry? The side effects catch yourself. I draw away and say way. Name one side effect or physiotherapists they are telling you, but they're giving you as a caution. Say shred a one folly. Yeah, dear, but no said the beya enkofa afiasiema. And I appreciate carers. So, banana former with our voice, and Tina says, a healthcare professional be brain, ube who no complain or back, complain or back. First, an idiot, Nanka be and one now, your crew, what it to a near mouse. Oteto ani amount so bahan more yen na damage wechi and of course that is what they are supposed to do. So what theater na say nya de so mbetimi aboa ama was sorry by yourself yen kase omumo wa mumo abomo empeja but say wo age say be a voice e wo ho no ma mbetim dia page we free for body then they can help you but say ye page out ye kukuru wo de and need ye advocate say my yen kukuru nipa.
That's it.
That's it.
Pacho, Brother John is our show. Na wakasa, Pacho.
Pacho, my sister Philippa. Hello. Pacho, what's your name?
Me Pacho, I.
Okay. Sister Philippa, that's Sister Rose, thank you very much for coming as well. Thank you for the in-depth with your mind. David, type 2 diabetes in the asset. And before GP for so much about who are more help you almost type 2 diabetes. And if you tell Bisa me about type 2 diabetes, I am one. Now, me what bear 3 questions. Hey, oh no, you're expert in diabetes area, or the Ubenya home, as some character actually. I tell you, one of them, no, you nearly said it, but me please me clear. To my first question, I say, there are some people be a morning you did go command. No, almost say if you see among collaborating, but they have never been big people or near Kasiada. And now, only say ni family, Obia, what diabetes, rather. But when we are GP or buy and yes, or type 2 diabetes. Yes, yes, pre-diabetes. After uncle second test, also diabetes. But also, you might be our any idea. If you think a human no too much of exercise enough, the diabetes in the recent. I'm thinking, say, said your cancer, mommy be Ofiga buy a diagnosis now as a mommy diagnosis. Is it not a possibility of such? I know you have one question. You know, about answer the next one. Say,
We patch out to us so patch out to us.
What the no to put an mammy a bit because what we can be for slim people are more diabetes, type 2, especially. And number 2, promo no yamao, if I say okay, we are diabetes or you are trying to prevent it. Sir, sugar, and we and you or I say don't eat them. But however, the already replaces our sugars, you know. Who drinks, yes, diet something, diet drink, diet whatever. And tablets here, you usually do a granule. And look at that chair, you see to may more side on why a whole research is a sadden. Is it not more of sugar than the sugar itself? I know you have a second question. Meaning, say, be a more research over there. We want to know something whether they are more that diet. You are there, you know, so I'm going to be. And number 3, we should be in recent times, Ubewos will be better. Also, now me diabetic, but my program be so. I must say the diabetes is gone. I think it's now becoming common. Internet is so advert be no money. So I'm thinking, say, I'm asking, say, is it true, say, that diabetes, type 2 diabetes can be treated and can be eradicated? And also, I know because fine, Ubo Hawa diabetic type 2 for a long time, and the person get relief from with this type of program. And I saw Omo pre diabetes for one Omo the ultimate from Omo. That's it. 3 questions, please.
Okay, me that's very brave, Mr. Odum. Let's start from the latter. So prevention, say nipa remission, yes. Type 2 diabetes, you can go through remission. Not just say you better your blood test no any hobby at that time. One, a beer certain factors, all can say programs. The vigorous one outside now, America for near drive on the it's just started coming here, but NHS agree totally, but some of the private doctors are using. Okwa dietitians ne do be go through. Normally, yes, CADD make us a diet take a whole lot of a whole day activity. Say normally, yes, we here 2,000 calories a day. And it's our robots program no. Yetimi amount just quarter, almost started with 500 or maximum of 900 calories, grams of carbohydrate a day. So imagine from 2,000 to 500 and 900. Enti eno a supervised environment. Uye we nyina no bi okra na ye liquid nko a. Enti yemfa ne say wadi wanum sade ye liquid no within few seconds or minutes na a free system no. Na ya sign the work go through physical activity account. Enti there is a program out there by NHS and taking absolute entirely. Oka say be a wenya ni sesia. Normally say wenya ni dadada. Now you are so in good control. Say be a be your HbA1c no, and also be your daily blood glucose no. Ne under 10. Maybe 6, 5, 6, 7, 8. And I say HbA1c, we 48, less than 60. Now say you do code through robust training. Say cut half of daily carbohydrate intake. Now obey your physical activity account. So utimi yes way dear, and dear you can go into remission. A lot of my patients are go through remission. Basically because among any kakra 80s, 90s, and those age, you know, or maybe be okra a fede krana onidi bio. Obedi dia be a 2-3 teaspoon, bibi kakra bi, and tisa nipa no, and I'm say onidi onya carbohydrate intino, ne so ate. Into the moment I was so besanyati akahonon, and also so low carbohydrate intake, you know, of course, and no bema swati. And now was a physical activity, vigorous one, and also bema swati, into way yina betimi akahon, ama go through remission. Now, here is a caveat. Can you maintain it? Bisa oma omuko remission no, after 1 year, after 2 years, they come back. My patients be no mama try omunroso. Now ya cancer, so they've gone into now we discontinue neuro now. Catch the GP say be after a year, after 2 years, on repeating HbA1c no. Obe hu ebe na say as a big deal credit me should to call over 100. And it's obe to me and maintain lifestyle no. A lot of physical activity, low carbohydrate intake, and need the ube to me stay in remission throughout. If I mean says our question answer, Mr. Odum.
Matthias, Matthias, I think say any say this anani well, I also NHS in meeting almost come slow. Almost go on away. Because any mom almost say nipa no say why diabetes na no na mo the amani so away. Na ne was start ye bibi na say ye so ye hunu any ade na nuro na ye ton
It's coming. Say no, almost started with prevention program no. Meaning say Cambridge almost started almost the diabetes team, any dietitian team no. I started yes a robust research no. No the findings neba ebe rolling through NHS. Na America no say yes started say ye do to I would take it 2,000 calories near to 500. So how long can you maintain it? So that is where the government is not so much, because a habit we are did this much now. And how much how long can we maintain that level of diet, throughout? But let's watch and see. Maybe a better roll out in all the NHS very soon. And I'm
okay. Me pacho to us, so we are not worried with the question.
Okay. And now, okay, second one, say diet and you can say your mouth diet and I say drinks beer. You better say replace with carbohydrate with this. And I said there's diabetic diet written out there. Me pamcho, there is no diabetic diet anywhere. Just promotional a promotional activity food and drug company for be used to. Or take sugar ni free ho, nor the securities, other source of sugar, not omodiagum. And there is no diabetic diet anywhere, but it's out there in the market. And now what kind of drinks? So I don't, in natural way, advise me patient via say koto diabetic diet. The medication said, so we did 2 pots of yogurt, the one pot of yogurt. So we know 2 fuzzy drinks, and I said soda. Medication say maybe reduce the ebra 1. Say usha coke, yes say diet coke. Yes, say low sugar, low calorie, low sugar coke. More constituted with a different source of sugar. There will be a lot of saccharides, and all that. There diabetes for the two instead of sugar replacing, and no omodia shemuma, and no my natural sugar ne free, which is also source of sugar, and increase or blood glucose at that time, but it's going to cause you more weight gain. And it's all increase weight, then the problem is not solved. And a minimum, cut it down. So unum coke bring it down to 1. Ubetimia replacing it with water. So ubetimia. So untimina say unum 1 num half. Just reduce the volume. May advise me patient be say put the diabetic diet, whatever it is, they would bring it to a minimum, cut it down, reduce it to a minimum. Mr. Odumpacho Hono have as they answered. And now final one, so now we can say obi or yes slave. Now your diagnosis is said type 2. So once blood na mini lady nekasa, and I make a trend say there is indication say diabetes, but then we didn't know because also started with a neuro now onyanto insulin so or started with oral tablet and so sila na nroni bia ni hwa eboano mob starting insulin, but insulin volume no na M1. And to say na woka history na it should compel the practitioner not to do further tests. Remember, say HbA1c and I say glucose level ne was there is indication of diabetes, but which type of diabetes it is, and known now be a different blood test. And they are finding out say at the end what type of diabetes and a nipani air presente. Lady also me so tia neti me so tibebre me say my back half of me weight. Me did all right. Me jun so bebre and na a draw though me what diabetes a draw so there, but still my blood glucose was so. And to should ring you the professional say, or the person is on treatment, but then what is happening? Why is she not being managing? Into hono na obey that test. And yes, obi away what rule out family history? Said diabetes in honum. Oh mommy, oh papa, from bien honum. Still yes, so your diabetes. Or diabetes, and any further investigation. And some of the blood tests says here, your friend, anti-GAD and a C-peptide, anti-professional should go deeper and do these tests to actually find out the right diagnosis for you. And just you will not be able to manage the diabetes because diagnosis near right near the right treatment na amount. Mr. Oduminim, so question is answered, Anna.
I'm Pacha Medasi. Yes, thank you very much.
Mpacho Medasi.
Mpacho Edo Warren Sawosro.
Mpacho Inti.
Yo, good evening, Sister Rosemont. Actually, I think so you made a boy P now. Me how about when I'm say you move as a first year back, but I think say we have to be honest and you can't say it here. He say no me you want shake akra say fufu ikra no ya de bone ba this say you make sure say fufu no ankasa no ene enam no ehunu se yeti abroche nti e say yeso ma no e say chichimu yi na ehunu say vegetables no e more nti eti fufu na ankasa so. So boy p yes so almost on pemono so and your mother who said the caps no cabo na say to so na me kai maybe a call jumadi bi baby on and African CB a car say also African no na say momodia no Ghana for modia no cabo ndoso na ye mi kromo de ye try say better so kakra na mo de so monte hwe Patchodi ne bitin aye because on say any the attitude o making obi etin fufu ho a odi na nadwe o ono na abo 80 so on tehwe kra akwadwuma ba ne nsada fufu ma odi the time I di ye fufu yi on ye fufu nkwa because on pe fufu ti na kan ho samsa but me pe fufu pa actually but just say bi ani di na enye anti there is that wall and yes how e be stigma bi won ye bi wo ye ho say oh, Ada, Mausa, that's a funo, but what you want, you kama. Yes, I was honey man, those things. But he who said, Ebi, I'm a swatika cardia because, hey, I'm said that's a problem, or you ain't sure ye, and now ye, so that sort of thing. There's this thing, sir. So, good living, you know, eh, so you day, you do, what you funo, but kama, or funo, or ya kama, that sort of, honey man, on. Now, my question is, please help us because yes, what kind of theory, what kind of practical aspect, but you need be a chimwa, Ebianca, boy, me, son, and yet see one see a pass, so obi a foot na so tia, none papa moa, nanya ebia, answer a common kununa, a bridge or buy no chicken na, a boon on the sabe, when you're being ye, any other Mr. Boy, a crow na, near Bua, my call a hospital appointment be. Some of us yɛmpɛ doctor call nti doctor no nya ba call so yɛ multi kransa no wagya call ama doctor na aka sama me ho adwiri me pa but I thought say I was okay nti also me a pre-diabetic me am share me nti person me ebia boy na so it might help us change some of these habits and it's a lifesaver this perhaps we need a part 2 that's
yeah mpacho me that's me bre mpacho me timi ma comment na Mpacho, say we should chroma for more scanner. There be a make say why and how is it that we should your chroma your court your 2 any shifia esikafono apart from say nansenya or muko crow way they say or muko koye plastic surgery reduce some weight affluent people be a person be organ be a eso or the back room ha or more sikano. How do they look like? Omunyina ye slim. Mi pacho ye fufu ni ye nyaidi. Ye wache ni ye nyaidi. Ye mwonu ye nyaidi. But said ye minya bema okaye no. Quantity. Si ye bedi fufu na kakrebi. It's all right. Be a friend we free adwuma aba. Untimi mfa fufu enkwa adwuma as. Sorry. Untimi mfa fufu enko ho nkotena adwuma mu ni. One funny thing me microwave the above. Please be aware of other people when your food smells. Now this is racist. Anyway, untimi mfa fufu enko adwuma nti wa ba samre na abedu fufu no. Mesre moara. Si edi fufu ni wie, yedi apesie ni wie, yedi wache ni wie, yedi mu ni wie. So you bake me and take at least 30 minutes. What bread here? na si edidi wie na ma yenkotena sofa mu mi yenkotena sati mu mi yenko obi wo hokra excuse me to say bi kra odidi no na otene mpa so e wo there enti obewie kra wanhwe kra ne nsa wo kra no because wa bre adwuma na edin enti owie ya ne nsa kra wanhwe a wo kro na odi akwakoda mpa no say yetimi didi wie na yetimi ye at least small physical activity minimum 20 minutes Emma aduane no atwom se make us sensitivity enti se yetwe ye ho a first and foremost yante so kakra yes ye pay fufu me baby band also be the laza na say eno enye no na medi ofie medi body medi banku medi bibia what say me ni fufu enti ye kro maduane bia medi enti yante so kakra quantity yenhwe quantity na ye di no said ye kan ye no yes enam na efo ha but dodo say ani here you don't need a lot of that for one kwan bebre so emfa so di wie na wa me a no munsuo gu so wo di wie na wa me a fufuo ni so na wa me a eye kakra di fruit bi na fa to so na fa combine say ye be di fufuo no yes na enam no na etwa ho ahia just because at least so they compare hana efo esen fie enti no good living said ye twetwa de to all media hwe fufuo a medi na kind of thing no ye aduane a ye didu but the quantity of it no ye behwe say ye beti so a na ye didi wie a ye ntena ye TV nachi ye a little bit of exercise a little bit of work so wouldn't if dan kese mu kura would ye pace up and about e wo bedroom wa would didi wie na would ye cause form ukọ umpeti ukoba 10 minutes 15 minutes na feel so betimi ada wada senka best ni senka ye nidi ntem but said the make no wuntimi mfa aduane no enko adwumam wabedru 12 hour wabfe no wabedru 8 enti wabedru no saa tem na say do heavy food because unya bibi papa bi eniye enti se obeti so kakra bi na wa exercise kakra aka ho a na face no ye nwene ho say enye kese ene ye healthy living enye kese ene kire say wo ho to wohwe abrofo na ewo mu sika na omu bia ni honom a omu akese ewo mu bebresa nanso ye de ne opposite ai asumasi na say de o worry ye o yire hwe ye anase say de wasumajo wasumajo de na ewom ma pie wo honam mu so na pie o health matters so say bia wasumajo no wada yi obekọ no o GP nka bibia ebema ye ma show say o bia o ye pre-diabetic enti no wasumajo no said obi kind okoye ne eye test no yes it's improving it's getting better enti wasumajo ko GP honoma onka papa nchiro say oh me check your blood test me check bibia no bibia koyie enti to aso ye ne sa and actually say wasumajo because ye disasem no be boss so na afi de krampo de asen ase wadwini bebre pamcho minim se ma answer wa yina.
Yes, you have. Thank you very much. Sure.
Amen. That's
me pacho me who say Sister Lydia answer was true.
Pacho me that's it. That's it. Pa mo me sure. Na me fa baby ama me so me ho adwiri me kakra ni say na ye nim say corset cry e bo no sometimes no e ma ye ho kire ana de enso asu bi e ba ye so e bi ana ye mu bi a wo nti no e mu ayidu kakra e pese ye reduce weight kakra we exercise a honamre ne arthritis from so no na ama honam nyina sa ya oya the next day no nti bi a wo try say when e me mo corset na enyi saade no emfiri ho na ye bon so na saade wo kan susan so e de bebre na enye papa but is there any way bi a ebetumi aboa yen anka ye benya ebetumi reduce so de wa ka say ye reduce ye didie ni ade ade ye try say ye be ni na eno ye me question ba ko na mpa cho de so mi no ebi ana obi nso wo pre diabetic here ye ka ho asem but then ya chere say only brown rice only some nnuane ebeboa no brown bread ni ade but yes so we kwa kodi dwa be ye aduane no nipa ni nni mpacho me kru na kasa aye no aduane no me share da kodi hu dwa odi ba ko pe baako no kora wantumi andi sɛ yɛfrɛ wo sɛ kɔtwe mogya na ɔyam hyehyew nti ɛno saa no deɛ na yɛbɛtumi ayɛ aboa no sɛdeɛ ɛbɛyɛ a ɛnka ne ntoɔ ma yɛn ho nkyerɛ meda ase
Medase bebree ate Lydia. Mpacho em say medical set no example kyerɛ sɛ saa na internally no yɛmfa ne sɛ oso na fat etare pancreas ne so. Mede yɛ example sɛ wabɔ set na wo sɛ wo ho kyerɛw. Enti saa na fat no etare pancreas ne so no ne ho kyerɛ no fa. Enti mpacho just to clarify that mede yɛ example. Enti manka sɛ yɛ mmɔ. Na make us say pancreas no se cause de krade at least ye boy ye to ho enti pancreas no et said ye yabo corset no mia for 1 day 30 days 100 days years saa na ye fu ni ye kese na fat ni dɔɔso a saa na pancreas no bre
mpacho me that's
if I show aduane no normally no obi ka say and na me yes ka so a ye tua me de ese me ni nyina brown rice and yet taste ni bi wo mi fie and you know anything na with the flavor beka ho say bia taste ni eya restra eno na midi but me say me yare de and ye medi de ye de any taste and probably sauce na de beka ho no we still know and e be ye flavor some na or de by rice no aka ho. The reason was make us a diet in Kwaye BB thing to talk entirely about it. Brown rice, it take longer and sana sichire no a free. Unlike white rice, no udi say udi brown rice instead say 4 hours, be a bit take about 3 hours and sana sugar na start here release it. But ye di white rice within 30 minutes an hour no na sugar na start here release it. Enti ena omu change ni sa amount no na said the maker no nyame anim ne brown rice and as a modified diet beka say we pre diabetic say di no we you be a who very good taste bad wanum ye o de na o ketre maso atre na nim de eda o mpese obedi because aya na nidie na ede enti de ode beka ho no se bia nkwan kora na maybe nkwan no mu enye de na omfa enti mo no beti ne kakra bi no afa nkwan ni bebre enti se stew so na odi dia obefa stew bebre maybe different kinds of stew obeye be vegetables nko na odi whatever mpacho me pese me treat diet wo ha enti ni die edi enti de ode beka ho no eye flavor e ma ne taste se eno beboa. Now the reason is say it take longer and sana I release the sugar no. Same as brown bread in asifo and I say seeded bread it take longer and sana sugar no glucose ne wom no I release it. Intina ya recommended that no. Auntie Lydia Mpacho meaning say my answer or question na.
Mpacho answer na ja ye fa ne say we try bia ifa na mpe nkwan na ompe vegetables na
Ayede. Enti maybe still now obey no add other things to it. Maybe spice up and I change juice and that's on what's on the obey but with the rice with the rice brown rice maybe the jollof rice beside the beans so at the frame na me the beans fra na me the jollof rice bibisa just a bit of difference via a bemana but because brown rice I know say because it one me di
pache me that's me sure
that's
say emreko pa but as a meti so bi kasa obi answer ni so nti so obi was mbisa bi atwa to a na intimi release yen sister. Okay. And you mean who said be a obi answer anka say Sister Rosemond Nyankopon shaw pa enim say time I dey ma ya fa no bebre and now also so nya abotre any odo ato obo achechire mu amanya tia se wado mu asukọ pa yi Nyankopon shaw ese onya sa openo na o church yensa enim say yebesa ya tonsa afro na obaji yenso enti Manchester Piccadilly nyina na many health ministry that was it. After me stress say, eja usu, na nakwesi usu Michelle, ubebo mpaye na close yen, na ode sister Rosemond ashe Nyankopon nsa, ani nebusua nyinaa. Ti nana usu ebebo saa mpaye no ama yen.
Anyway, above for your doorstep. Yes, I can food in the mouse. So, the water, near Mobra, by a woman way. Would Gina Sada, any ye, and then Tontum. Enka. Oh, I want crown star, and you may so, like I say, the Rade, you may at the Wabawa, Shavon Sapa, or Nimdia, what the Amoabawa, what media church say. Ra, if I would show boy, now some bar cumbia, and number power so at the archery. I am one more than any to me, I bet me the idea may upon Jin na I showed him congratulating. If he say, any pedia out the Amayno, Ra will boo and one thing. Inti yes, throw, what can't I see the dio and more? Yen French when yam. And unti any pedia, Ra near me one more. Enye nieme woma yesi ye na yintimi nye apomdin a yesi ye hweso ye yintimi hweso ye enyankopon obebusa yen ho asem enu nti yesrew na ya ho amode na yintimi fanhwe apomdin so ye ni yintimi nsom ye yesrew edi waba wa nso adwuma a wo ye nso hyewonsa se koso amani nimdie ni nhumu na wonkɔ n'anim na nhyɛ wo Awurade animuonyam. Anwumre yɛpɛ yɛkraw na yɛkɔda. Yɛsɛ ɔma abɔfo pa no mɛbɔ yɛn ho ban mfiri wiem atumfo ne ahombɔne nsɛm. Wo a wohyira a obi ntimi nnome no, kɔ so hyira wo ma na yɛsi so yi, rafa yɛn nan si deɛ kron wɔ Yesu Kristo wo din mu. Amen.
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 Insha so say ba ahoma so yenkai say kwesi da bia nwumre 6:45 ye HealthEnrich na we invite unia bi because unia bi ho mfa no ana unia bi anhwe na pomuden yi a ebi eka won so na afen so ye wi na Bible studies ato aso ene de se na edi kan no yenye ento aso yenhye ne nsonso say 14th of September na ye health expo no. You be invited a lot of teams. So in the last year, yes, if I hear now this time around screenings be beba researchers ebeba around. In your banner chair and say before research into no and to me diagnose ye to me and so near social share. Into your bar and I invite you for never take it part. See and take it that opportunity no. Nyankopon shine in a minim sempenny for us penny for
Enuanom yɛda yɛn nyinaa ho ase anwummerɛ yi mepam kyɛw yɛka yɛ ho gala bi ɛba so nyame yɛ adom a ɛyɛ ɛnnɛ no a wɔtwe pɛpɛɛpɛ ɛyɛ kwasiada 25th mede announcement ato platform no so na wei deɛ mehyɛ mu kena yɛn nyinaa yɛnyɛ nhyehyɛ asafo no mu nyinaa dwumadie nsafo ahodoɔ mmiɛnsa ɛna ɛka wɔn ho abom ɛyɛ Manchester Piccadilly Leeds New Generation ɛne Bolton asafo and ya cabo ma sanche beko so agokansie or bludu or worry dame bibi biara enti oba be man kwara obia benyam chefa we de nkoye football nko a enti anuanom wonya nhyehyɛ a yɛbɛsrɛ sɛ yɛnhyehyɛ masa da no a ɛyɛ na wɔtwe sɛ ne pɛpɛɛpɛ no nkono apa ho meet aduasa nyame nhyira ahemache mpaebɔ enso ɛkɔ so. God bless each and everyone.
Amen. Yeah, now Miss Pa.